From the east, west, north, and south, there's been a conversation that's been on everybody's lip, and that is the conversation of the state of health in Nigeria, because health is everybody's business. But before we get into the conversation, let me officially welcome you to a new day here on Signature Television. My name is Godwin Sunday. Today we'll be talking about the state of our primary health care centers in Nigeria. And who best is to talk about this issue if not a medical doctor who have had an outstanding record in the medical field. This morning I'm talking with Dr. Melitius Aboyi, who is a medical doctor, and we'll be talking about the state of health in Nigeria this morning. You're welcome to New Day on Signature Television, Doctor.
Thank you very much. Thanks for having me here.
All right, so let's get to this conversation. But first, the state of our primary health care is somehow as it stands right now. But the conversation is, how did we get here as a people?
Thank you. Just like every other thing Nigerian, our primary health center was supposed to be the signature centers for healthcare in our community and in our country. The father of primary healthcare in Nigeria is supposed to be Professor Olikoye Ransom Kuti of blessed memory. Somehow he envisaged this program, brought it up. Then it's about 40 years or thereabouts ago. I was still a medical student then. It's more than 40 years, yes, because I've practiced for nearly 40 years now. And it's been the way it is. So the thing is, the budget money put the place, build massive centers, but they don't populate it with the medical personnel necessary for this program to take off. For instance, if you have a primary health center with a medical doctor, with nurses and other paramilitary, paramedical personnel, like laboratory centers, every pregnant woman will be happy to go there. Your wife, my wife, everybody will want to go there and deliver. If you're sick with things like malaria, typhoid, not the commercial one they now have, you want to go there and get treated. First, because it's close to you. It's supposed to be cheap. But what happens is that we build massive centers, no personnel. Some of them have not seen a doctor in the last 10 years. Nurses, they don't have qualified nurses. What they have is probably maybe a senior community health extension worker who turns the place into, because for lack of what to do with the place, turns it into some kind of a mini business for her and her immediate family. And so women don't have the confidence to go there and deliver. Because of that, they stay away from it, and the place gets bushy, and from there it gets dilapidated, and nobody gets interested. That's the challenge that we have in our primary health center. If it can be made well, I can tell you that the cases that you see in Federal Medical Center, National Hospital, and maybe University of Abuja Teaching Hospital, with Abuja as a reference point, will greatly and drastically reduce. That much I'm sure of.
Well, Doctor, thank you so much for that overview. Let's even talk about the north, since you've mentioned Abuja.
Yes.
There is a sickness. I don't know if you should call it a sickness, or there's a kind of a condition in the north known as ectodermal dysplasia. Okay. Now, to a very large extent, we've seen parents throw their children outside, and we've seen the primary health care not even know how to provide solutions to this case. Some children are even tagged to be spiritually attacked, and as such they are driven out of their houses.
That's what.
Yeah, go ahead, Doctor.
It's the same thing I'm trying to say. If the correct medical personnel are there, ab initio, they will make the clinical diagnosis of some of these conditions. It's not just what you mentioned, but every other thing. For instance, you see children with diseases in their mouths, things that could easily be tackled. Just yesterday, you were seeing things that people who came, children, urchins who came out to protest of a bad governance or something, are being starved. Who does that? Those are the kind of things that should be taken care at the primary health center level. The proper diagnosis is made by a qualified medical personnel, handled, treated by all other ancillary parts of the medical profession. And you don't see it to that extent. But here, what we do is the reverse. I don't know. How do the children say it? Who do this to us? I think we'll find a way to make it. Because once we get this primary health center thing going properly, you see that everything that is medicine here is taken care of. For instance, a woman, because they say it from cradle to the grave. If a woman is pregnant and the baby is cared from there properly through the processes, even diet for the woman who is pregnant and the baby who is born, up to when he grows into a man or a woman, as the case may be, until he gets to the stage where he says, okay, don't eat this, don't eat that. All these are things that you'll be sure that are taken care of at the primary care level, but we don't do it. I think we need to have a rebirth. Let's get back to the beginning, do this correctly, and make sure that these things are done properly, and everybody will be happier for it.
But Doctor, to a large extent,
yes,
the primary healthcare system has not worked in Nigeria. And as we speak right now, to a very large extent, again, it's not working in Nigeria. Talking about remote communities far in the north, talking about communities that deep down in the far east, that we've seen primary health centers being abandoned, like you've rightly said. Medical doctors are not talking about this, having this as a conversation. Shouldn't this be that medical doctors should be at the forefront of championing the cause for there to be a revamp of the system of primary health care?
Well, Mr. Godwin, thank you so much. The truth about it is the medical doctor is just part of Nigeria. He is not away from what the normal folks also experience. How far would he talk? If he talks, would it make any sense? Would it make any difference? The people who are in the legislature, who make these laws, they know how to implement them. The people who are in the executive, who implement these laws, also know how to do it. Medical doctors are just part of the system who eke out their living among the populace. If you bring a doctor, take him to a remote center like you said, say Borno, Yobe, Lagos, Enugu, Ibadan, as the case may be, no matter how remote the place is, and you make his living condition very nice. He stays there, you pay him his wages, he treats the people. Mind you, treating a patient and his security is assured that nobody, it's not tomorrow, one hoodlum will come and bundle him away and start mentioning an outrageous amount of money to pay to release him. That way, doctors will go there and work and get paid. The doctors also go to the same market that you go, your wife go, my own wife goes. That's how it is. So yeah, doctors are not removed. We're not remote from the general populace. We also go to the same market. As we are coming here, you are driving petrol, I was driving petrol. We go to the same filling station to buy the same fuel. If you can pay for your own, I, who is a doctor, or even a younger colleague who is supposed to go to those remote places, also go to the filling station. His condition should be made in such a way that he can stay there, his security is assured, his house is taken care of. That also, not only the doctor, including the nurses, the laboratory scientists, the senior community health extension workers who also work with these people. If all these things are taken care of, the primary health center will work, and the teaching hospitals will be relieved, the general hospitals will be relieved of the pressure that they are presently on. I was I'm the immediate past chairman of Association of Nigerian Private Medical Practitioners here in FCT. And I know what we pass through. The private hospital, some patients come, they don't have any means of being taken care of. And you, the private practitioner, cannot take care of them because you don't have such a budget. Government has a budget that takes care of the poor and the vulnerable. Those primary health centers are the places where they be aggregated, taken care of, and the government, for one reason or the other, will write off those things. And so that is what we are saying. The primary health centers must work for all our health system to be normal and taken care of. That way.
All right. Thank you, Doctor.
Thank you, my dear.
Doctor, to a large extent, Dr. Mellitus, you said that the government has not been doing enough to sustain the primary health care facilities, and also in terms of provision of personnel. But on the other hand, the government, I've come out to also point accusing fingers at medical doctors who have been assigned, who have taken the Hippocratic oath, and they've sworn to save lives, and they've been assigned to primary health care. A lot of them who abandon those primary health care and go about their normal daily businesses and activity, while the government keeps paying them salary on the other hand. Now, it's a true argument at this point, but let's look at it from a broader sense. Can we altogether push the blame to the government and exonerate the medical doctors from this particular conversation?
Well, I told you, it's like the primary health care we're talking about. It's like every other thing in Nigeria. Everybody has a blame. The government, if I want to be challenged on this, if they improve a health center, put in personnel there, the necessary personnel, and pay them adequately for what they are doing, you will not see any of those people move away from where they are being employed. And their security is assured. For instance, if you go to your village, because your village has a primary health care center, my village has a primary health care center. Now, the idea is that if in the creeks of the Niger Delta, in Borno, at the remotest places in Borno State, at the extent of Calabar, where those ones bordering Cameroon, all those places, it's envisaged that they all have primary health center. Put in the personnel, pay them adequately, provide the necessary security so that it's not, because this wave that people are disappearing in this country, it's making everybody very scary. You yourself, who is a journalist, interviewing me, your child may be a doctor, your child may be a nurse, your child may be a senior community health extension worker, your child might be a laboratory scientist. And if he's sent to those places, are you sure that you come home and sleep with your two eyes closed? That's the whole idea. The people who are rendering the services, they are ready to render the services, but they are there. Sometimes you don't even remember to pay them. Sometimes the drugs are not there. Sometimes the equipment they use to work for those in the lab are not there. For sometimes the doctor will be there, make a diagnosis for maybe a breech presentation of a child, or even a child that is not well positioned, that needs a cesarean section. He knows what to do. He cannot do it. He's just there looking. That makes him look like a stupid person. And that is why we're saying that these things should be from the basics. Provide the facility. But it's not just building fantastic edifices and going to commission them. No, what we're saying is that those edifices, when you commission them, in fact, before you commission them, the necessary infrastructure that are necessary in those places should be in place. There should be a theater for the doctor to operate, even if it's minor surgeries. There should be a delivery room for a woman to go and put to bed. So a midwife will go take care of the child and deliver the woman and protect the child. That way you'll be sure that the primary health centers are working. It's not, primary health centers doesn't just mean fantastic buildings. No. Primary health center means that the whole spectra of medical personnel are there in those buildings. And you'll be happy yourself. Everybody, in fact, it's a win-win situation. If the envisaged thing that Professor Likoye Ransom Kuti had in mind had worked, or is allowed to work, primary health center is just the most beautiful part of it. Before you see a cancer case in Abuja, those cancer cases must have been seen in their villages, diagnosed, or even seen early enough, because there are some cancers that if you see them early enough, let's say for instance, if you see a breast cancer case at first or second stage, you can do a radical mastectomy and the woman survives for as long as God wants it. But if a case is there, first they say, what they do is that they say is a spiritual attack. Then they'll start from the pastor, the village pastor, move from there if he gets, because the thing is not getting clear, then they will move to maybe a local hospital who probably makes a diagnosis. Before those things get to the teaching hospital or toward a secondary care where those things has metastasized, and therefore the woman may not survive it. These are things that ordinarily would have been taken care of early enough, and everybody will be happy for it. So primary health center is the numero uno in terms if we want to get our health systems right.
Well, Doctor,
thank you.
To another extent,
Yes.
we've seen situations where items provided by the government, laboratory equipment provided for efficient operation of primary health care, all of a sudden they get missing. And it can only take a person that is into medical practice to be able to buy those equipment. So are there policy, are there programs put by the Nigerian Medical Council to ensure disciplinary actions are meted on them, doctors that are found wanting in such a case of this magnitude?
It is not the work of the Medical Association to guard what the government provided. There are logbooks. If you supply, say, measles vaccine, for instance, you supplied 10. We want to be very practical now. Let us say you supply 10. Those 10 that moves to primary health center A, the children they are used to immunize, their names will be there, their ages, sometimes even their mothers. So you check through that and make sure that those things have been given. At the end of the month, the thing is returned to take a new one. If they don't return, they don't take new ones. The same thing with drugs. But what happens here is that sometimes the drugs stay in the state medical store and it expires there. And then they get thrown away. That's why we're telling you that it's a system problem. It's not an individual problem. There are books. In fact, if you get to my office now, there are more than, let me be very fair, up to 10 books charting all the things they supplied. Family planning, commodities, HIV kits, determine that they supplied, how they are used, when they finish, when they are supplying the next one. And if you don't make a return, you don't get new ones. So all these stories about this thing, the fish starts getting rotten from the head. And that is where the problem is. If the right necessary things are followed, there are logistical books that they follow to make these things possible. And therefore, it's not the medical profession, the medical association is not their job. It is the job of, in fact, even logistics officers at the state level who take care of this thing. Recently, I heard the FCT minister go to a primary health center, and I would like to know how far they've gone with that. Not just that he will go there, build a fantastic building without any adequate provision for medical personnel, for consumables. That's what we call it. Because if, what we call it, if you bring a pack of gloves, when he finishes, it needs to be replaced. Otherwise, the doctor will not use his bare hand. It's not safe for the patient, it's not safe for the doctor to use his bare hand to continue doing what he's doing. And for a particular patient, you could use up to 2 or 3 or 4 gloves just for that. Maybe you use a glove differently to examine the patient, you remove it. You use a different glove to remove the waste that you have removed. If there's another side of the patient you need to examine, you also take another glove. Before you know it, the 100 inside that pack has finished. And as you're taking, your assistant is taking. And the other cleaners who are also in the hierarchy of the medical profession are also taking. These things have to be provided, replaced when they finish. Not those who have that have expired, thrown away, or returned back to the state medical store so that they know these things were not used. That way, it will be a win-win situation for everybody.
But doctor,
yes,
if the Nigerian Medical Council
yes,
has no place for sanctioning doctors that have been found with equipment from the Nigerian medical, from the primary health care facilities,
yes,
wouldn't this further promote the kind of irregularities that we see in the primary health care centers as it stands right now?
That's exactly what I'm trying to tell you, Mr. Godwin. The medical, it's not the Medical Association, it's the Medical and Dental Council that does that. Now, it is the government officers that will say, okay, we supply this man 100 syringes. He didn't use up to 20 of it. And the thing, we can't find the other 8. Then they make a report. If it's proved to the Medical and Dental Council, he will come. The Medical and Dental Council is the equivalent of a high court in Nigeria. That's the level where they are. So the Medical and Dental Disciplinary Tribunal has the level, the same jurisdiction with a high court of the Federation of Nigeria. So they will try the doctor, and if found guilty, either bar him from practicing for a certain number of months, or delist his name, as the case may be, from the register of doctors. If your name is no more in the register, in fact, a patent medicine dealer is better than you because he has a license from his organ. You don't have anything. So, but it takes time to get to that level. And of course, like in everything legal, his own side of the view must also be heard. Because if you tell the doctor to dispose of this thing when the thing gets, and he incinerates it within that health center, you won't go try him for what he didn't do. So it's a system problem. We all are involved in it, yes. And if we want to solve it, it must be also a system pattern to solve it. It's not going to be a one-way traffic that you do. No, it's so easy to stigmatize a doctor in Nigeria because the system doesn't work, and he is the one that comes first hand with the patient. And the patient feels that the doctor is the problem. No, it's not true. Recently, a woman was brought to my clinic by 2 a.m. I just discovered that the oxygen wasn't functioning. Who do I blame? Now, ordinarily, it should be my workers who didn't take an audit of the oxygen. Of course, before 10 a.m. the following morning, we have fixed it. And to the glory of God, we managed the woman and she was discharged safe and sound. If it is in government, that oxygen that we discovered, that I told you was fixed before 10 a.m., will stay for 1 month, because one officer will write to another officer will write to another officer, before they now respond. And patients will be suffering. That's part of the challenge. I did that because it's my center. and I know how to handle it. And in fact, by that 2 a.m., I woke up the man that was handling the oxygen stuff. I said, look at my problem. He said he was sleeping. I said, I know you were sleeping. Before 10 a.m. the following morning, he had come, fixed the oxygen, because I didn't want to have that kind of problem again, where I had to resuscitate a patient without oxygen when I needed to give oxygen. If it's in a government center, my dear, by now as we are talking, this thing may not have even reached, the report may not have reached the Oga, not to talk of having a response. So that's what we're talking about, these challenges we are facing. Yes.
Government in, government out have always shy away from public-private partnership in terms of primary health care centers. Is there a medical restrictions to why this has been a practice over time?
No, not to the best of my knowledge. I'm aware that Garki Hospital is in PPP.
In Garki General Hospital?
Yes.
And we're looking at the primary, even the primary, not before we even get to the secondary health.
It's a secondary health center,
yeah,
that's what I'm
secondary,
telling you.
yeah.
So there has not been any, there's no restriction at all.
Because the medical practice have a lot of restrictions from advertisement down to a lot of regulations.
Yes,
so
those things are restricted. For instance, we don't want one doctor to come and tell you, I'm Dr. E and I'm a better doctor than Dr. Godwin. Do you understand? That we try to avoid. However, in terms of the primary health care, the whole thing is in the hands of the government. If they want to do PPP with doctors, I'm sure there will be a lot of doctors, even retired ones, who are still active in the practice and not doing anything, who will take up the mantle and run those places as if it's their own, with, in fact, if you like, with profits, or at least they will be able to break even, unlike what is going on now. The thing is just for the government to prioritize their activities, give out those centers if they think they cannot manage, or if they think they can manage, put in doctors who will be part of what is going on there, and then the thing will work. It should work, and it must work for us to get it clear in this country. Yes.
Doctor,
yes.
At this point,
yes,
should we now say that the Nigerian primary health care center should be overhauled by the government?
I think that's what we've been saying all this while. Overhaul from the beginning to the end. And
because when we look at the blueprint, what I'm saying is, when we look at the blueprint of this whole primary health care services and centers, it doesn't seem like what has met the 21st century medical practice.
Yeah, but Mr. Godwin, everything in the world is dynamic. We should be running it, fine-tuning it, making sure that the correct things are done for it to improve. If it stagnates in one place, you don't expect it to. I think they say the change is the only permanent thing in life.
It's constant.
Yes. So if we want the thing to change, we must be changing. It's crazy to stand in one place and be blaming and thinking that you do the same thing the same way all the time and expect a change to come. It won't come. What would come is that you make a change. Okay, even if, okay, let's just say the PPP that you suggested, let's do a PPP. Run it for 5 years. Give it a trial with a proviso that if this thing doesn't meet this standard, let's remove it. After 5 years, we can sit down and say, okay, let's review this thing. But the challenge we have is that the new people who are taking over may not want to have this change to take effect and take place. If the necessary things are done, and we see this thing is not working, it's not a shameful thing to have, okay, say, look, this other method didn't work. Let's have a rejig of this thing. And the thing should work. and indeed must work if we want to get our health systems and priorities right in this country.
Well, Doctor,
yes,
is it not a time for perhaps medical doctors to start protesting or carrying placards on the road to talk about this issue of primary health care? Looking at it from a generic point of view, lives are going, generally at the rural level, 774 local governments. We can't authoritatively say that we have sufficient primary health care systems that are working at the 774 local governments. Shouldn't medical doctors start clamoring and speaking out? Or there are some restrictions that are attached to medical practice that they can't speak or can't agitate? The only time we see medical doctors come out to speak and agitate is when their rights are being violated, especially the housemanship and some other, right now the Jackpot syndrome, and it tends to affect them primarily. Yes. That we've seen them come out to agitate. But doesn't this call for from riots from the medical practice?
Well, demonstrating is an inalienable right of every human being, and indeed every Nigerian. I think it's even in the Constitution. It's not the same thing with rioting. Let me correct.
Okay, so let's do demonstration. Let's use the peaceful demonstration.
Listen,
I sincerely apologize.
Yes,
peaceful demonstration.
That's the. However, if you are demonstrating for something, the people you are demonstrating for, do they even appreciate what you are doing? If in the course of that problem you run into an issue, would the people you are demonstrating for even appreciate what you are doing? Do the Nigerian populace appreciate so much? And in any case, the doctor-patient relationship in Nigeria is so skewed that the doctor, how many doctors can even come out to demonstrate? How many are we? Medical doctors. Until recently, the Medical and Dental Council improved and doubled the admission quota for some states, and the federal government magnanimously in their wisdom has created some fresh medical schools for training of doctors and nurses and other ancillary staff. The doctor-patient ratio in this country was so bad that you wouldn't even have maybe. How many doctors are supposed to be in a local government? Local governments in this country are big. Some local governments are almost like states in some West African countries.
True.
And you don't have enough doctors there. You and I are in Abuja, and we are lucky that, well, the population of doctors here and that of Lagos, with maybe I don't know, I don't have the exact statistics.
And Port Harcourt and Kano, I think they still have
Port Harcourt.
Yeah.
Kano, well, Kano Metropolis. You wouldn't say the same thing for Kano in the hinterland. But Abuja is fairly well populated with doctors. But I can assure you, they all stay within Wuse, Gariki, Maitama, Asokoro. And with the fringes of Kubwa and Gwagwalada, because of the teaching hospital. The rest of the FCT are still under doctored, if you like me to use that word, and not to talk of nurses, and the few ones we even have are living with the Jackpot syndrome you are mentioning. Virtually every young doctor I know, including in the teaching hospitals, they are all planning how to live, including National Hospital. So there must be something that is going on with our remuneration system that is not consistent. Because if you say, okay, maybe with due respect, someone read, say, political science or philosophy or something, with due respect to those professions, for 4 years, and somebody stayed 8 years reading this thing, and took another 6 years to even qualify to be a consultant, and you want to put them at par, it won't work, and therefore the doctors will stay. In addition to the hard work that goes into all those things. Second MBBS have been touted as, by the Guinness Book of World Records, as the toughest exam in the world. And the doctors pass through second MBBS. Now they've come up with another one, you must have a PhD. doctors. I saw doctors protesting in Nnamdi Azikiwe the other day because they are kind of skimming them out of the vice chancellorship of the universities. If you don't have a PhD, you can't this thing. But I know that qualifying through maybe West African College or Nigerian College is tougher and stronger than some of those going through a PhD. I'm not putting any part of the academic program down. However, I am thinking that everybody must follow through the same process to be made a vice chancellor of a university, and that is where the problem comes from. So I don't know. We need to internalize our own programs. We mustn't do everything because maybe Britain and America is doing it. We insist on going through that processes. We must internalize our own problem to do it in such a way that everybody will have a fair hearing and a fair share of what is going on in the academic view. And that will also help in this thing we're doing. And that's why if you stay in a primary health center as a local doctor and maybe you observe something, you can do a paper on that thing, and the paper gets published, and maybe a university will be on the basis of that subject you to some this thing and give you a PhD or even a professorship, depending on the findings you made. But here, everybody must be in the ivory tower to be a professor, to be this, to be that. With that, you must necessarily concentrate the whole manpower within the university system, and is affecting the primary health center we are talking about. A doctor can stay in a local center and make a discovery that will give him a Nobel Peace Prize, as the case may be, because he saw something that nobody has seen, observed something that nobody has observed, and did the write-up on it, and it comes out nice. And some would even lead to enlivening or changing the way humanity thinks, or bring in some life-changing things that will even cure things like cancer. Somebody can be in a local health center and discover something that maybe will be a cure for cancer, makes a write-up, and the thing should be adopted. And those necessary things will be done to enliven him up. But it's not quite like that here yet. I hope that one day, soon, we'll get there.
We all hope that we'll get there one day. But doctor, let's, before I let you go,
yes,
viewers are curious at this point. The doctors, you've exonerated doctors from being blamed. Of course, the government will exonerate themselves from the fact that the taxpayers are not sufficiently providing enough fund for them to fund the health sector. But when two elephants fight, the grass suffers. And the grass in this case are the patients. In this case, what should patients do when the primary health cares are not working? Thank you.
I think what the patients do, we're all patients, so quite frankly.
Well, you're a doctor.
Yes. As a doctor, I also fall sick.
Okay.
Yes. So everybody, even a professor of medicine, is a patient, first and foremost, before becoming a doctor.
So she'll say potential patient.
Potential patient. Yes, thank you. Maybe that's a better word to use. But the truth about it is that we should all have some kind of enlightenment, some kind of building up, so that we all hold governments to their words, let them do the necessary things. Every government, everything comes from the government, everything. Indeed, somebody said that after God, the next person is government, and government is you and I. So if our political awareness comes up, the government will do their own part, like what we have been doing. The doctors will fall in. It's automatic. They don't even have any other alternative than to fall in. The nurses will fall in, the medical scientists will fall in, the laboratory, whatever, everybody will just naturally fall in, and this thing will start working. So it's not a matter of putting the doctor in the guillotine to cut his neck off. No, that's wrong. The way it is that all of us are involved in this thing, and all of us should be involved in getting a solution to it. Otherwise, it won't work. And it has to work for all of us to be beneficiaries. In fact, even if, for the doctor, for instance, if you reach a certain age, you automatically become a patient. Because when you get to the level where you have to be, you are hypertensive, you have arthritis, you have diabetes, not because you didn't live your life well, but because of the age where you are, you've started suffering what geriatrics suffer. Geriatrics, sorry, by the way, is old age. When you get to a certain age, you become old. And when you become old, you start suffering what old age people suffer. For instance, if you saw your father or your mother, if he wakes up in the morning, it's no more the same way he was waking up maybe 20, 30 years ago with agility that he now wakes up. So everybody is actually praying to get to that level. That's the prayer of everybody, especially in Nigeria, if you ask me. And so we will all eventually, God keeping you alive, get to that level where you need the primary health center to even measure the BP, to even measure your blood sugar, to even check your diet, to even wake you up. When you wake up from sleep and you slept somehow, you go to ask question, doctor, which doctor, and the doctor knows you. You should really be familiar with you. Why? Because you live close to him, you discuss with him, you play tennis with him, you socialize with him, and he knows you. So if there's a change in you, you should be able to ask, my friend, have you been doing this? Have you been taking your exercise seriously? Have you been eating right? The water you drink, is it from the right source? The electricity you take, is it okay for you? Do you eat well? Do you even have people who come to greet you? Unlike in Western world where somebody will be in his house and nobody greets him. Those are some of the things we should internalize. I'm afraid, unfortunately, we try to copy everything Western. The aspect of socializing is something we should hold high, emulate it the way we are doing, not them that don't greet each other. They don't socialize. Everybody minds his business. This idea of minding your business is not good, and it's not good for us.
Well, Doctor, want to say thank you so much for finding out time to be with us today.
The pleasure is mine.
It has been a very interesting conversation discussing with you on the state of the Nigerian primary health care system. It's not an easy conversation to come by because it's a conversation that evokes a lot of emotions. The way we go around the state and across the country, you see the way people are suffering, especially in remote communities. Yes. Sometimes we feel for doctors, although we're journalists, but then we can't help. We're just like, okay, it is well. But thank you so much for your time today. And we've been talking to Dr. Mellitus Ebonyi, and we'll be talking about the state of primary health care in Nigeria so far. And I know that the government will be able to take up certain responsibilities as we've discussed on this table, and some of the solutions being provided here on this table will be taken up by the government to ensure that we are able to ameliorate the sufferings of Nigerians and also drive the primary health care system to be more proactive, to be more efficient, and to be more effective, especially to people in rural community. I am Godwin Sunday, and this is how far we can run this morning. Till I come your way again, same time, same station. Keep watching Signature Television. From all of us here in the studio, it's bye for now.